What is the chips and salsa theory when it comes to manual lymphatic drainage versus post-op massage? The chips and salsa theory is something that I came up with because I want to explain to a massage therapist that has MLD training. I want to explain the role of post-op massage training if that massage therapist wants to help people after plastic surgery, after liposuction. And they have that MLD training and they kind of say, you know, like, why should I spend this extra money on these additional classes? I think that I can just give these people MLD and that they will be happy. And I think if you have a little bit of liposuction and it's the kind of case where the surgeon's like, oh, if you want to get massages, then you can, but it's up to you. Then maybe like just a few sessions of MLD might do the trick for that client. But if someone has more surgery, if they have several different surgeries, if they are coming to you and saying, hey, I'm worried about these lumps and bumps I'm having, I'm worried about hardness, I'm worried about tightness, I'm scared of fibrosis, and what do I need as far as massages to help me get to my best results? I think at that point, that client needs loaded nachos. And loaded nachos is, so the chips and salsa are in there, but loaded nachos is more than just the chips and salsa. Loaded nachos is the post-op massage. And if you give a client who is convinced that they need loaded nachos, just chips and salsa, and tell them, hey, just keep on coming back and I'll give you more salsa and I'll give you more chips, they are not going to be satisfied. If the client wants to feel like you're doing something during the massage and all you're giving them is just like a really light touch, light as a feather MLD session, they are going to either not rebook or not be satisfied at the end and, you know, think they could have done more, or they're going to go to the therapist down the street that does no post-op massage. So all of this actually isn't just in the client's head. Because as lymphedema therapists, if someone comes to us with stage 2 lymphedema, with stage 3 lymphedema, they're not just getting chips and salsa. They're getting MLD, which they need, but they're also getting what we call as lymphedema therapists, deeper techniques. And we teach these deeper techniques at conferences. So if you go to a conference with lymphedema therapists, you can go to a class that teaches different types of fibrosis massage. And I wanted to take those techniques that I've learned through all my traveling, through as a lymphedema therapist, helping people with stage 2 and stage 3 lymphedema, and going to the conferences, and I wanted to give it to massage therapists who have got the MLD part of it, but maybe they haven't got these fibrosis massage techniques yet. And I want to give it to these therapists and give them these demo videos of how I show you the different techniques that I use that help my clients in my studio. And I want to give it to you in a class that has continuing education credits. So I've separated out into 3 different classes that you can take. The first one that I highly recommend is a plastic surgery recovery and fibrosis massage class. That's a great place to start, and you'll kind of see an overview of my theory behind why we're doing different types of massage at different areas of wound healing. And then also I have separated out into 2 other classes, a lymphatic and fibrosis massage cupping class. So if you use cupping in your practice, this would be a great way to utilize it for people after plastic surgery, and also a myofascial techniques class that really addresses that tightness, that firmness, that stiffness that clients can sometimes come in talking about. And all the classes have demo videos. All the classes have continuing education credit. I'm a NCB TMB approved provider. So when you take the class and you pass the quiz, you're actually going to get continuing education for these classes. and I want to give you these tools. So instead of just offering chips and salsa, if the people really need the loaded nachos of post-op massage, you can also give them these great fibrosis techniques that will really help to reduce the lumps, reduce the bumps, reduce the hardness, reduce that tight feeling that they have, like pulling taffy in the morning, and kind of alleviate their fears of getting fibrosis because they didn't do enough massage or they didn't do the right type of massage after their plastic surgery.